Medicaid fraud. Fraud is defined by Merriam-Webster as an act of deceiving or misleading. It seems like fraud is in the news almost every day. Either someone committed fraud or fraud was committed on someone. Medicaid fraud is a growing problem in the United States today. There is no limit to the types of medical fraud that someone can do. My interest sparked for Medicaid fraud when I was at work because I approve and deny members of Tennessee for Medicaid every day. The Medicaid program and the rights of the poor, quote, was created by the federal government in 1965 to provide health care and service to people who cannot afford them. Medicaid is the largest public health insurance program for the poor. Every state has a Medicaid program. Anyone is eligible to apply for Medicaid, but not necessarily qualified. To be qualified for Medicaid, you must be at or below the 133 percentage of the federal poverty level for your household. When applying, you are required to report how many people are in your household and all incomes, including Social Security and deductions when applying. Failure to do so is considered fraud because you are lying on the application, which is misleading and deceiving. The three main categories that make someone eligible for Medicaid includes being pregnant, being a caretaker of someone who is considered a child to your state. So for instance, in Tennessee, you must have a minor living with you that is 18 or younger because 19 is considered an adult in Tennessee. The other category which puts you eligible to receive Medicaid is being a child. So with all three of these categories, you are eligible, but you do have to fall between that 133 percentage of your household income at the federal poverty level. So Medicaid is a growing issue in America today. At issue, does the United States need a national health insurance policy informs, quote, providers such as doctors, hospitals, or physical therapists, as well as consumers, can engage in fraud, and crimes may be committed by singular individuals or wide-reaching rings of people. Some of these schemes include phantom billing, which is services that are not performed, but you are still billed for. Another scheme is billing for unnecessary procedures. So it is quite common that some doctors may advertise that there is no purchase necessary for them to do procedures on you, yet they do bill whatever insurance you have, including Medicaid, which is a type of fraud because it is an unnecessary procedure done. Another scheme is consumers that are selling their prescription drugs on the black market to profit off of these. So a lot of people I know do sell psychiatric drugs that they are prescribed for, but they are not using them. They are getting money off of it. So it is causing taxpayers money to pay for these drugs, yet they are profiting off of it by getting that money. At issue informs that convictions may take a few years to investigate. So oftentimes, if it's just a few times that these these consumers or physicians do this, they're most likely not caught because they have to see a pattern of these schemes in order to convict you. According to CMS.gov, Medicaid spending grew 3.9% to $565.5 billion in 2016. The site concludes that it is expected to reach $5.7 trillion by the year 2026. The magazine How to Stop Medicaid Fraud says, quote, experts estimate that abuses of Medicaid eat up at least 10% of the program's total cost nationwide, a waste of $30 billion a year. So you may be thinking of how the solution is that we can stop all this fraudulent activities. You may be thinking we should just stop Medicaid as a whole. However, this would not benefit taxpayers. It is a law that if someone visits an emergency room and does require treatment, that the emergency room cannot deny them for services even if they are unable to pay. So if we were to put a stop to Medicaid, all these uninsured Americans would cost taxpayers more money because the emergency room does cost a lot more than just a regular doctor's visit. So ultimately, it would be hurting our taxpayer dollars. The magazine How to Stop Medicaid Fraud also suggests that states are working together to stop these fraudulent issues by using high-powered computer programs to monitor these schemes and find patterns, and also getting tougher with the penalties and making it harder for crooked providers to get Medicaid dollars. As a result, we save taxpayers billions of dollars by just these new procedures and policies that we are doing. So now that you know about Medicaid, if you are a Medicaid recipient and thinking about committing fraud, you might want to think twice before committing one of these frauds. And if you do know anybody with Medicaid or who is committing medical fraud, you now know that how it is affecting these taxpayers, and you might want to think twice. Thank you.